Very good evening, everyone. Myself, Rakesh Gurla, Manas Coordinator. I welcome you all to the School Psychology Certificate course on behalf of Manas, the Academy of Psychology, Rajamahendravaram. So, the School Psychology program is a certificate course of 90-hour duration, which will be consisting of both theory and assignment. So, there will be 30 to 40 hours of theory hours, and rest will be allotted to your assignment work, case studies, and various activities. Those are assigned by our mentor. So theory classes are conducted on every Wednesday and Saturday at same timing 7 to 9 p.m. So I myself will be your course supervisor. I will be monitoring your attendance and post all the needful material information in WhatsApp group. So I request you to all look into the group description to further details and instructions of the course details. So this is the small briefing. So I finally request Dr. Narayana to our voice of course to commence today's introductory session. Sir,
Yeah, Rakesh, thank you.
sure.
I request everyone to switch on your camera. I think we are very few people, so it's good that uh, we can see each other. And uh, I welcome you all for this certificate course on school psychology. Uh, and as I said, this is very a small batch this time. I'll explain so what's going in this entire course, how it will be go on, and so what are the different uh, what you call it as a syllabus and other things. I'll just share my screen. Once again, welcome you all. This is certificate course and training on school psychology. So as Rakesh said, it is 9 hours, 3 months intensive course, which starts from today. So today I am more focused on introductory thing because what is exactly the course is, how it happens, and all. And I just want to introduce myself. I am Dr. Narayana Nakina. So I am from Rajamandri, Andhra Pradesh, India. So I have completed my master's, MPhil, PhD, and some other postgraduate diploma courses from Andhra University. And I have been 15 years of experience in psychology, both counseling, school psychology, and psychometrics. And now I am working as a head of the Department of Psychology, Adikavi Nannaya University, Andhra Pradesh. So previously, I used to work in as an associate professor in Ethiopia, University of Gondar, and after that, I came back to India and I was settled in Rajamahendravaram. And myself, I'm very much interested in psychology because with the passion I have came to this field from computer science, and especially school psychology, counseling psychology, and psychological testing, psychometrics. These are the main areas which I deal with in all my experience. I mean, all my 15 years of experience. And this is briefly about me. Maybe you will know when I am taking. I mean, while taking classes, maybe you get to know about me more and more. And I just want to know about yourself. So it's very happy to know about you. And I mean, I can say that this is a challenging group for me because people are from different kinds of different backgrounds, mostly from I mean, non-psychology background people. And now this training, or I mean, this training needed few things, which is what exactly things needed for this course. Or the first one is time. So why I mentioned that time means a minimum of 10 hours a week, including theory and assignments. So if you want to know more and more, we have only 4 hours theory and almost 6 hours some kinds of assignments. We don't bother you. and you don't need to write I mean a longer time, longer period, and writing notes a lot like that. It's just like assignment means we used to give some kind of topics, and we used to suggest some movies. You need to watch it, you need to review it, and maybe you can search some data from Google and you can present it, or maybe you can prepare some small PPT, 4 5 slides, and you can present it. So the time, at least minimum of 8 to 10 hours, should be allotted for this training program, because this is the only 3 months training. So if you can afford that much of time, so you can learn more and more. But theory is only for 4 hours weekly. I'll tell you, weekly 2 days and each 2 hours. And the second thing is mobile or computer. You should have a good gadget which is comfortable to you. Either maybe you can use laptop or maybe you can use mobile, no problem, because even in laptop also the teachment app will be used. So you can directly use from your browser. So maybe if you want, Rakesh will help you how to use the laptop and all, using this teachment and all. And thirdly, a notepad and pen. So please be with the a notepad and pen. So this can be helpful to understand and note down some points, or maybe writing something like which is you feel that is interested, and anything. Because if you are on a course, you should write something what has happened in these 2 hours, or what has happened in this theory class. And so that is the important one. And fourth one is try to be ready with the good internet connection. Maybe either it is on mobile or maybe Wi-Fi. Better to use Wi-Fi if it is available. Or maybe if you don't have a Wi-Fi, maybe you can use mobile internet, where you can get the good signal. So please try to manage yourself. And the fifth one is the commitment. So which is more important for any person for any course completion, because we used to join different kinds of courses, but if you have a strong commitment, then only you can complete the course. And try to attend classes regularly on time. So we will remind you each class. For example, we have only 2 days weekly, so we will inform you in the morning that today we have a class, and in the same time both the days, every day we will inform you. So you have a class, you have assignments and everything. So no need to worry. We will remind you all the time. And but if sometimes it happens, because we are all humans, so we do have some commitments, we do have some maybe parties, or maybe any kind of functions. So that time maybe you can follow the recorded video. So all recorded videos are available. It's a lifetime. Maybe you can watch after this course also, but you cannot share the video, but you can watch a number of times. And if you have any kind of doubts and all, maybe you can get back to me. There is no problem, not only for this course, maybe after this course also, we will be available to clear your doubts with respect to the psychology, not only school psychology, anything you can ask. And these are the things needed for this training or course. And then maybe you can mention your expectations from this course, maybe after this complete um, presentation. So we'll keep your questions, note it down it, and you can shoot me after this presentation. And so about this course, so I just want to tell you, it is a comprehensive course. And school psychology, why kept it for 90 hours means that it's completely comprehensive course. So we will explain everything, and each and every point will be discussed, even if it is not there in syllabus also. Maybe you can ask me anytime. Maybe doctor, can you explain this concept? Maybe we can include along with our schedule and all. So it's a comprehensive course. 90 hours in-depth training, as I said. 30 hours teaching classes means theory classes, and 60 hours assignments or some kind of small tests, or maybe group discussions or whatever it is. So 30 plus 60 roughly. It includes practical approach. We used to give some kind of examples like case studies, or maybe we used to give some kind of videos we have to watch, and we have to write reviews on that. So it includes practical approach and guidance and testing and case writing. See, generally in every courses we used to have theoretical knowledge, but here we try to impose and we try to learn more on, like, testing and case writing. Maybe non-psychology background people, they may think that what is this kind of, I mean, what is psychological testing and all. Maybe I'll explain you. Testing is more important for psychology, not only school psychology, any psychology. So either it is in counseling or whether it is in health psychology, testing should be there. So testing, we will explain different kinds of tests, and we will also explain how to write case. So people need to know about drafting the case, how to write the case. So we will give you some modules, and we will give you some models to how to write the case and all. And the foundation for practice, maybe after this course, if you want to practice school psychology, we will give all kinds of foundation that so actually what is school psychology, what is psychopathology of children, and how the problems used to raised in the schools, and all these things. And the next one is certificate and performance letter. So we used to give certificate, course completion certificate, along with the performance letter. The performance letter is completely based on your performance. So we will assess your performance and we will give you the grade. So based on that, either it is excellent or good or average or whatever it is. And for every batch, we used to give best performance award based on excellence. So maybe one person will get best performance award from your batch. So who is the we consider here the performance of the person. So how he is attending the classes, and how he is doing his assignments, and how he is what you call it as responding, and all this will be considered, and we will give the best performance award. And this is generally about the course. And now I just explain about roles and responsibilities of um, from your side. So why we used to mention these roles and responsibilities? We just want to give a kind of I can say that it's like a just we just keep it in mind, and it's like a warning bells or whatever it is. Attendance is important, as I said, weekly 2 days. So mostly try to attend maximum Wednesday and Saturday. And completion of assignments, please provide some time and complete assignments. The assignments, you need not to sit hours together. Just maybe if you can sit 1 hour or 30 minutes, you can complete your assignment. And doubt should be at the end, but I would like to answer your doubts anytime. So no problem, I can manage myself, and you can ask your doubts, any kind of doubt. And the follow supervisor's instructions, and Rakesh will coordinate you, and please follow his instructions. Maybe he will inform you about the materials and about the assignments and about anything related to the course. And go through reading materials. So for after every class, we used to provide the PowerPoint along with some reading materials. Like maybe sometimes we will give you some books, and sometimes we will give you some reading materials, like Word or something, Power PDF and all. And drop your questions in group. If you have any questions, please drop in the WhatsApp group, and maybe we will take a few. Um, I can say that, maybe if I am available immediately, I'll give you the answer. Otherwise, please be patient. Definitely, I will give you the answer before evening. Because if I am in the university, maybe I'm a bit busy with some other administration works. But definitely, as early as I will attend your queries in the group, or maybe you can also ping my separate, directly to my WhatsApp number. So you will get my number from the group itself. And respect others' views. Sometimes, so we used to have some discussions. So respect others' views and go with them. Maybe we cannot have the same kind of opinion for every concept along with all the people. So respect others' views, and maybe sometimes we may have some kind of debate that's only for getting knowledge, so not anything else. And please cooperate with management, and which means that you have to cooperate with the Rakesh much more, because he will be communicate with you all things and all. And I request you listen, learn, and lead your future. So why I am mentioning this last line means that listen carefully, and you can question me, learn, and some of the people, they want to they want to make their future in this area. So lead your future in this way. So these are the brief roles and responsibilities of this course. And now we move on to course module. So this is the course module. So we have 11 units, or maybe I can say that 11 chapters, um, briefly. And the first one is Introduction to School Psychology. So here uh, we more discuss about what is school psychology, how it's when it started, and uh, know about school psychology, and even we also discuss about the what is psychology also. So introduction to school psychology, maybe we have few classes. After that, we are going to discuss about history, nature, and scope of school psychology. So the history of school psychology, as I said, so when it is started, who started this, and what is the present what do you call it as a scenario of school psychology in India and Western or any different kind of places, the nature of school psychology and the scope of school psychology. And the third unit is roles and functions of school psychologist. So uh, for every profession, there are particular roles and functions, specific roles and specific functions. So what are the roles and functions of school psychologist? So who is school psychologist? What are his roles and what are his functions? So what he want to do in the school? So all these things will be discussed in roles and functions of school psychologist. And the next one is, which is very much important, and everybody should learn about this thing, not only from background of psychology, anyone, which is concept of lifespan development. So it's we discuss from the womb to tomb. What is that? We discuss from womb to tomb, which means that what is our lifespan. So which is from prenatal to so aging. So what are the different types of development levels? So we discuss each level, and how it happens, at what age to age, and what are the developmental milestones in this age period, and all these things will be discussed. And the next one is exceptional and gifted child in schools. So we used to hear uh, children are different types. and some children are exceptional children. So what do you mean by exceptional? Means some children may have different kinds of skills, and some children may not be same with all the people. There's something different, and some people, some children, they are highly intellectual, gifted. So we discuss about exceptional children and gifted children in schools, and then the very much important topic, and every school psychologist should know about child psychopathology. So people used to know, pathology means that it talks about different kinds of problems, disorders, psychopathology. So child psychopathology, so what are the common psychological problems and different psychological problems used to have in the childhood? And maybe you can also generally I just want to say attention deficit disorder, ADHD, or autism. So psychopathology, which is deals with different kinds of disorders, and according to DSM-5 or maybe ICD-11, so what are the different kinds of psychological disorders which child used to get? All the things will be discussed because this is the biggest chapter in this entire course. And um, we discuss about child rearing practices. Child rearing practices. So how to, what are the different kinds of child rearing practices and all. And most importantly, we are going to discuss about classroom management and learning styles. I just want to ask you one question, that what is your learning style? Can anyone say what is your learning style?
Answer.
Hello? Yeah,
So
please.
basically, learning style. My learning style is like initially it is learning, then
Hmm.
it is unlearning, and then relearning.
Okay, good.
I can say visual learning, sir. I'm very
Yeah,
much interested as a visual learner.
yes.
I too
So
am a
thank you.
visual learner.
Yeah, very good.
From
And
known to unknown.
okay, from known to unknown. So we have a different kinds of learning styles: visual learning, auditory learning, kinesthetic learning, and all. So people used to learn different areas. Some people, they used to have photographic memory. So they learn well when they watch something. So visualizing things and all. So we discuss about different learning styles. So how to deal with the children if they have a certain learning style and all. And classroom management, which is the biggest problem in schools. So how to manage children in the classroom. So especially if the child used to have different kinds of problem, as I said, exceptional child. So if the child is a normal child, maybe it is easy to manage them. Maybe you can give some punishment, or maybe you can ask them to sit quiet, or maybe you can use any kind of giving some homework or like that. But if it is exceptional children, so how to manage the classroom? So classroom management and learning styles will be covered in this chapter. And one of the important area is psychological assessment. So I just want you people, so what do you mean by psychological assessment? How do you think when I say psychological assessment? Hello?
The
Yes, sir.
state of mind, sir.
State of mind, okay.
How
Some
to how they react
assessment
to
of
It
specific
personality
things.
and behavior of a person, sir.
Okay, assessment of a behavior of the person. Very good. Next.
Assessment through some questionnaire where we can ask them
Okay,
some questions and then
okay.
find
Assessment through some scales or questionnaires or maybe questions. Okay,
From
and
past history.
okay, assessment through past history. Mm-hmm. So what do you mean by academic assessment? Hello?
How they perform in their academics, like in the class,
Okay, how they performed in their academics, like tests and all, maybe unit tests or
Mm.
maybe term and examinations and all. Okay.
Day-to-day assessment, we can say, sir. Day-to-day.
Maybe we can say that day-to-day assessment, maybe people used to give some kind of questions and ask them to write in the classroom, any kind of thing. Okay. So psychological assessment, which which is helpful to understand the child. So you said many things like assessing using questionnaires, assessing their behavior, assessing their emotions. All these comes under psychological assessment. Psychological assessment, not only the behavior, not only their emotion, or not only their personality, and we can also measure their IQ, adjustment, and their stress levels. Some mental health problems and all kinds of psychological related using all kinds of psychological related testings. So in this chapter, we more concentrate on, I mean, that from the IQ test to different kinds of tests. So for example, if the child is dull, if the child is not performing well in the classroom, it might be maybe due to because of depression, or maybe because of anxiety, or maybe because of adjustment problem. So most of the children, they used to have adjustment problems in the classroom. Yes. So many people says that he is not studying well. Teachers used to say that he is not studying well. Why? Because he is not reading properly. But the child may have some kind of adjustment problem. So that has to be understand, and that has to be what you call it as assessed by the school psychologist. If you assess the child properly, which is it is very easy to understand his behavior, and we can easily counsel the child, and he can very much happy to get rid of that problem. And so we should understand child's problem first. So if you understand the child's problem, you should definitely use psychological assessment, because there is no other way to understand the child. So the only thing is psychological assessment will help you to understand the child's behavior or emotion, whatever it is. So we used to have two kinds of problems. Either it is behavioral problem or emotional problem. So these two will be affect the academic problem. So academic assessment, maybe we can say that scholastic aptitude test, or maybe term and examinations, or maybe any examinations which will be conducted by the school. All these academic assessments, maybe the parents also can assess the child academically at the home. So this is the ninth chapter, which is very much important in school psychology program. And the next one is clinical diagnosis of pupil behavior. So how to diagnose a child? Here I just want to tell you a small case. So if the child is restless, so he keep on roaming in the classroom, and he is not sitting properly. So he used to go outside, and he used to jumping from the tables, and he used to what do you call it, disturbing the other children in the classroom, and all these kinds of symptoms of the child. If I say all these things, maybe you can say that immediately say that the child is having some attention problem, isn't it? So so if you want to brand a child, that if the child is having ADHD, attention deficit hyperactive disorder, or maybe if the child is having attention problem, or maybe if the child is having hyperactive disorder, so you have to diagnose clinically. So if you want to diagnose the child clinically, definitely we should follow some rules and regulations. So these rules and regulations, where we can take it from these rules and regulations means that so we have to follow DSM-5 or maybe ICD-11. I'll tell you one thing. For example, if you visit a doctor, so you said that my temperature is high, I'm very sleepy, and I have some stomach pain, or maybe you may be given some kind of symptoms to the doctor. Doctor will assess you using some blood test. Then he will diagnose your problem using what? They have their own diagnosis process, which is there in what do you call it as diagnostic manual. Yes, every doctor used to have diagnostic manual, maybe which was approved by the Medical Council of India (MCI). So in the same way, in psychology, we used to have diagnosis manual, which is called DSM-5. Previously, which is DSM-4. Now we have DSM-5, and at the same time, we have another diagnosis criteria, which is called ICD-11, International Classification of Disorders, 11th version. So both versions we can use. I'll tell you, I'll explain you, and I'll show you the books and all in previous class. I mean, in next classes. Sorry. So this is about clinical diagnosis of people behavior, and the last one, but not the least, and which is counseling techniques and therapies. So here we are going to discuss what are the different kinds of counseling techniques and therapies which we will use in schools. So how to help the these counseling techniques on children. Maybe we are not going to discuss deeply about the each therapy, but I will mention all kinds of therapies, how it will works on the children and all. Maybe we can also have a discussion about that, and maybe in future, maybe we can also have some kind of workshops on each therapy and all. Maybe definitely we will discuss all kinds of counseling techniques, how to deal with them, how to sit with them, how to discuss with them, and everything will be discussed in this course. So these 11 units, or it's, I mean, every unit should be discussed in this course. So on an average, each, I can say that each unit will be discussed a couple of days, 2 days or some. For example, if it is child psychopathology, it will take more classes, and psychological assessment, it will take more classes. So roughly, each unit will be discussed 2 to 3 days, and for everything, I will provide you the content which I am discussing, even along with the PowerPoint presentations. So we will post all the PowerPoints, and along with some textbooks and material and all. So this is about the course module. I think I'm clear, right? Hello, are
Yes,
you
sir.
there? Yes, yes.
Yes, sir.
Thank you. Yeah.
Yes, sir.
So
Yes.
this is about the course outcome, sorry, the course and the content of the course, how the course will be go on, and maybe you can shoot me with your questions. I'll just stop sharing the presentation. Yeah, you can ask me if you have any queries, questions. Um,
Yes, sir. I have a question.
yes, please, Praveen.
Sir, how do you get like hands-on or practical exposure towards counseling of the students in this session, like the sessions which is going to be covered like that?
Okay, so for example, we used to give some recorded videos. For example, if I am explaining about the ADHD child, maybe we will provide some videos, and maybe you can watch them, and you can write your comments on the video, and we will discuss the entire video in the classroom. And maybe if you are working in the schools, you can observe some people, like, case studies and all. So you can get some hands-on training, because it's completely based on both parties, not only from the Manas, not only from the Dr. Narayana. It should be depends upon your side also.
Yes, sir. Definitely. Sure, sure, sure.
Sure, right. So, any other questions? You can also ask in local language. Maybe I'm comfortable in Telugu, English. Maybe I can answer even if you can ask me in Hindi also. No problem. Radhika Garu, do you have any questions?
Like school means what all it covers, sir, overall?
So, as I said,
Uh,
completely
Course module.
school related problems. So,
Mm-hmm.
how to manage children in the school, and mostly we used to have major problems in the school. Means that they have different kinds of difficulties. So
Mm-hmm.
most of the children, they used to get less marks. Maybe teacher used to complain that your child is not good, your child is not performing well. But they usually teachers, they don't bother about what is happening to the child's mental health.
Yes.
They are more concentrated on their marks and all. And not only that, we also discuss about lifespan development, which means that from the childhood to um, adolescents and young adults. So, what are the different kinds of changes they used to have, and along with their behavioral changes and all. So,
Can we identify and rectify the problems of a child as a
yeah,
teacher?
definitely, you can identify the problem of the child. In most of the cases, maybe you can meet the child's needs using some counseling. But in critical cases, we are not allowed to do the therapies because, for example, if the child is having some mental retardation, or if
Mm-hmm.
the child is having some kind of attention deficit disorder, so for them, we need to refer them to the clinical psychologist because
Mm-hmm.
they are licensed to do all these kinds of things. But
Okay.
a basic level, and most of the times we can manage with the child if the child is mild and moderate areas.
Okay, sir.
Am I clear?
Yes, sir.
Sir, I have a question. Does
Yeah,
this course
please.
is limited to only school psychology, or can we say it as a student psychology?
uh, Chiranjeev Garu, mostly we can say that school psychology, which is very similar to the student psychology.
Yes,
uh,
sir.
yes, because student psychology means that all the students are now, maybe we can say that school psychology starts from early age, but
Mm.
it will go on with the adolescent age. But as you said, student psychology means that even the graduation children and postgraduates are also students.
Yes.
But if we can understand the child's behavior, we can easily understand adult behavior. I mean, young adult behavior.
Yes, sir. Because I'm working in higher education, I'm just thinking like whether the course will be restricted or limited to a school students age only, or
Uh,
can we able to relate it to higher education level of
you
students
can
also?
able to relate because if you understand the child more, you can easily understand the adult.
Ah, okay, okay.
Uh,
Thank you, sir. That is
I
the only reason I joined this course because though
I
it
think
is school specific.
even if you are assessing the child, even the same kinds of tests we will use for young adults also. For example, for assessment part, if you want to see IQ test of the child, so generally, maybe after the eighth standard, we will use the same IQ test for upper classes also, even for
Okay,
adults also.
okay,
So you
okay.
can get
Clear.
a clear picture on how student will what you call this. So as you said, from your point of view, um, more or less you can understand more about the school children up to higher education, like 12th standard, not higher education. Up to 12th standard, we can discuss all kinds of problems.
Okay, sir. Okay. Thank you, sir.
And any other questions? Lakshmi saying,
Sir,
Yes,
yeah,
sir.
yeah. Any
Sorry,
questions
sir, I
sir.
saying?
want.
Any,
Yeah,
just a minute.
yeah. Yeah,
Yeah.
I wanted to ask, like the adolescent issues, would be able to address the adolescent issues with the children in the
Yes,
school?
ma'am. Yeah, we will discuss about the adolescent issues in the school.
Yeah.
Yes, definitely, because
And
adolescent.
about yeah,
Yeah.
and
Yes.
about the psychological test, so you would give us the standard test, the format and all, or do we also learn how to make the test,
Uh,
or how
no, no,
we
no.
can go up?
I will provide you some standardized tests which are free and which
Yeah.
are non-restricted. And
Okay.
some tests I will maybe suggest you, if you can, if you want, you can um, take it from any, I mean, any department of psychology or Tata institutes or like that, because they are
Okay.
licensed for some tests. And mostly I will suggest you some free tests. For example, if you want to measure depression of adolescent, I'll give you
Mm.
some tests for that. Maybe it can be used by anyone, and you can
Okay.
screen the child. So in the same
Okay.
way, for example, if you want to assess the anxiety or academic problems or maybe some mental health problems or like that, so I will give you as much as I can, but
Okay.
not all, because some are licensed completely, because we need to buy those things.
Yes, yes. So basically, we can do the basic screening of the students, not like
Yes.
a proper treatment kind of a thing. Like we'll have to
uh,
refer it to the clinical psychologist if they are extreme cases, but if
yeah,
they are
yeah,
mild,
definitely,
help.
because we should not, yeah, because we should not lock in between law and other things, because
Yeah,
so when you observe the child is severe or moderate, so better to refer those children to the clinical psychologist, because we are not supposed to do. Why I am saying we are not supposed to do? For that, you need to complete MPhil in clinical psychology, or
yeah,
maybe you need to complete a master's in clinical psychology, which is recognized by RCI. That is the more important, Rehabilitation
yeah.
Council of India. Maybe very near future, we have a separate body in
Mhm.
India, which is there is a Mental Health Act which was already passed in Parliament. So very soon we have a body like MCI, Medical
Sincere.
Council of India. So we used to have Psychological Council of India very soon, maybe in couple of years.
Okay.
So hope for the best. And this is about introductory class. So from Wednesday, we start from A, like, so what is psychology and all, and not exactly. Don't bother about. I don't. What you bore. I mean, I don't want to get bored you, because we just briefly know about what is psychology, and then immediately we'll go for the what is school psychology and all. Then we can move on. So this is all about today's introductory class. And if you want to listen this class, after this class, immediately it will be available in your app, a Teachment app. And I suggest you to familiarize with the app, because this is the new app for you. Definitely, maybe one or two people may know, but other people, they are very new for this Teachment app. So just see the options and go through it and learn more about the app. If you have any doubt, immediately raise your doubt in the group of WhatsApp group. Rakesh will answer. Sometimes I will also answer you immediately. And see you guys on Wednesday. We will remind you in the group. So the first class will be started from Wednesday. Thank you. Have a good day.